very good afternoon and warm welcome to all our viewers. My name is Dipali Safaya and I welcome you all to We Talk Do You show, a show by Puberty to Menopause, a public health awareness initiative by Human Biologicals Institute, where we try to provide expert medical advice and create awareness on women's health. Puberty to Menopause is yet another platform created by Human Biological Institute. It is my pleasure to take this opportunity and share about Human Biologicals Institute. Human Biological Institute, a division of Indian proven wellness products and infertility ranges of hormones. While coming to our vision, mission, and values, our vision is shaping global healthcare by spearheading the One Health initiative. Our mission is to produce and market quality healthcare products and services to improve and extend lives. While coming to our values, we believe in providing affordable products with high quality through continuous technical innovations and improvements to meet our customers' need. As we know, we are the kind of company who will definitely look after taking care of the environment as well. We proudly bring before you the Green Initiative. As we have launched our flagship brand, anti-rabies vaccine Abhayarab, and with this we have taken significant step to reduce the plastic burden by 160 ton per annum. As a company, we don't just manufacture and market products, but Human Biological Institute has done a lot in corporate social responsibility and has taken up various projects. One such project is adoption of government school. Indian Immunological Limited has adopted two government schools in the vicinity of its Karkapatla facility in Hyderabad. Another program is Gift Milk Program in coordination with National Dairy Development Board. We are giving additional nutritional supplement to over 1600 school-going children of Telangana and Tamil Nadu. We have also facilitated the setup of oxygen generation plant at Telangana Institute of Medical Sciences, Gachibowli. The unique advantage of this oxygen plant is that it is capable of supplying oxygen to 70 patients at a time. You can visit us on our website www.indieimmune.com and can contact us on our toll-free number 1800-313-999977. You can follow us on LinkedIn, YouTube, Facebook, Instagram, and Twitter. And you can also go through our unique initiatives and everything you want to know about women health on www.pubertytomenopause.com. So once again, I welcome all our viewers who have joined us live today. Well, World IVF Day is celebrated on 25th each year. The special day commemorates the birth of Louise Brown, the first baby born through the in vitro fertilization in 1978. The celebration aims to raise awareness about infertility issue, highlighting the advancement in reproductive technology, and also offer support and hope to couples facing fertility challenges. It serves as a reminder of the significant impact IVF has had on countless lives, making parenthood possible for many who struggle with infertility. Well, in today's show, we are going to talk about a very important yet crucial topic, psychological and emotional aspects of PCOS related infertility. To know about this, we have a very special guest with us today. Please welcome Dr. Saveri Sarabai Saxena. Dr. Saveri is distinguished obstetrician and gynecologist. Her extensive training and experience have made her highly sought after medical professional in the field of women's health. Currently, Dr. Saxena practices at VY Hospital in Sarabai Polyclinic, where she is known for her exceptional patient care and dedication to improving women's well-being. Her expertise in obstetrics and gynecology has earned her a reputation as a compassionate and skilled practitioner. In the past, Dr. Saxena served as an assistant professor at KMC Hospital in Mangalore, where she not only excelled in patient care but also contributed to the education and training future of future healthcare professionals. Throughout her career, Dr. Saveri has remained committed to providing the highest standard of medical care, improving women with the knowledge and support they need to lead healthy lives. Her contributions to the field continue to inspire and positively impact the medical community. A very warm welcome, Doctor.
Thank you.
Well, Doctor, while we start for our discussion for today, and for the topic that we have is a physiological and emotional aspect of PCOS related fertility. Doctor, as we know, PCOS can lead to infertility due to irregular or absent ovulation, hormonal imbalances, and the presence of ovarian cyst. The first question I want to ask you, Doctor, is can you please provide a brief explanation of what PCOS is and how does it affect the fertility?
PCOS or polycystic ovarian syndrome. This is, as the name suggests, it's a syndrome which consists of many things. Uh, Once we talk about the positive thing, there are genetic factors as well as the environmental factors. When both of these factors combine, they form a syndrome which is called as the polycystic ovarian syndrome. Now, as the name suggests, people when they think, then they are told that they have PCOS, they think that they have an ovarian cyst, but that is a false concept. That is not like that. PCOS means it is a syndrome which is comprising of usually irregular menses, meaning infrequent menses. Then, because of chronic anovulation, then there will be unwanted hair in the female, like unwanted facial hair. That these are the signs of hyperandrogenism. Then there will be obesity, and also sometimes it can even lead to metabolic syndrome, and it can even lead to infertility, obviously because of anovulation.
Uh, yes, doctor. So, doctor, I want to ask you is, as you provide the explanation about the PCOS, I want to ask you that what can be the most common symptoms and signs of PCOS that women should be aware of?
Okay. First of all, we should know that PCOS can happen in what all women. It can happen from adolescent to even a perimenopausal lady. PCOS can affect all. And as we are seeing, because of the sedentary lifestyle and the kind of food which we are eating, there because of the prevalence of junk food and all, the prevalence of PCOS is increasing day by day. And any woman who has the following symptoms, like there is obesity. Obesity is one of the environmental factors which affects it, which causes the PCOS to develop. And once the PCOS develops, it is very difficult to lose weight also. So, if they have obesity, if there are irregular menstruation, meaning infrequent menstruation, that is, any woman who is having her menses after 35 to 40 days or more should suspect PCOS. If they have symptoms of hyperandrogenism, like unwanted facial hair, any hoarseness of voice, if they have problems in conceiving, like they are having difficulty in conceiving, or these type of symptoms if any person is having, they should always consult their doctor to see if they have PCOS. But just because an ultrasound is showing PCOS morphology, they should not come to the conclusion that it is surely there. Only if the two out of the three criteria are there, then only we call it as PCOS.
Thank you, doctor, for answering this very simply. Doctor, I want to ask you is, are there any kind of specific diagnostic test or criteria which can, use to identify that, okay, this patient is having PCOS?
There are actually many criteria which are prevalent. One of them is the Rotterdam criteria. According to the Rotterdam criteria, there are three criteria. Out of which, if two are present, we call it as the patient is suffering from PCOS. One is I told is chronic anovulation. That is the patient will be having infrequent menstruation, and in that, for example, in a year she'll be having less than 8 menses. If a person is having that, that means we can say there is chronic anovulation. That is one. Second, if she has any characters of hyperandrogenism, means acne, frequent acne breakouts are there, frequent unwanted facial hair is there is hoarseness of voice, there is like male features on a female. So, and or if there is any biochemical evidence of hyper, like increase in the serum testosterone levels. Okay, then there are many hormonal markers also which we can also do. So that is another criteria. Then the third criteria is ultrasonographic features of PCO morphology in the ovary. In that, in the ultrasound, we see the ovary, what is the size of the ovary, what is the volume, how many follicles are there, what is the number of the follicles, the size of the follicles, and what is their distribution. So with that, those criteria, we term it as a PCO morphology or not. Out of these three criteria, if any two are present, then we call it as a polycystic ovarian syndrome. And once this is there, it can manifest in many ways.
Thank you, doctor. As you mentioned about these diagnostic tests, and also in previous, when you were describing about the PCOS, you mentioned the word lifestyle change. So, doctor, I want to ask you is, are there any lifestyle changes or modification that can help manage PCOS, which is related with infertility?
Yes, definitely. When we talk about PCOS and its treatment, the number one treatment or the first line management of PCOS is lifestyle modification. Everything else which the doctors do comes next. So that is what we need to explain it to everybody, that lifestyle modification is a must. It is not supplementary or complementary. That is the first treatment which needs to be done. And in that, the most important one is weight control. I'm not saying that PCOS happens only in obese women. There is something called as lean PCOS also. But obesity helps the PCOS to develop, and then because of PCOS also it is very difficult to lose the weight. So it's kind of a vicious circle which needs to break somewhere. So the first thing which we want from our from anyone who is suffering from PCOS is lifestyle modification, which primarily means weight control. Which, and anyone if anyone is suffering from lean PCO also needs to follow these things. One is diet, and another is exercise. When we talk about exercise, we are talking about anything that person likes. It can be yoga, it can be zumba, it can be swimming, it can be badminton, anything which anyone can like. We're just talking about some physical activity which should be maybe 45 to 1 hour, but regularity is very important. They should try to do it at least if not every day, then at least 5 days out of a week, and it should be a vigorous physical activity. And then when we talk about diet, there are certain nutritional changes which we'll need to do. One is obviously portion control, and then to decrease anything, but in simple words, when I tell my patients, it is like you have to decrease the carbohydrates. So like rice, chapati, potatoes, and then anything which is containing maida, like all our junk foods, the pizza, burger, Maggie. Okay, then anything containing refined sugar like tea, coffee. These, we are not cutting back everything. We are not doing any zero thing. We are just decreasing the amount and then increasing in the protein-rich diet. And then one another thing is that we can have salad 1 hour before the food, and also include yogurt at the end of the food. So, a balanced diet and regular exercise is the key to the lifestyle modification, and that is the first thing which anyone needs to do to combat PCOS.
Thank you, doctor. It was very simpler way you mentioned about the carbohydrates that we have to cut down, what all we have to take. So, doctor, the next one to ask, as you mentioned about the lifestyle change as well as the diagnostic test. So, what are the available treatment options for women with PCOS who are experiencing the infertility?
Okay, there are many treatment options. First of all, the treatment of PCOS depends upon what problem that person is having. For example, if there is adolescent PCOS and they are having irregularity of the menstrual cycles or heavy menstrual bleeding, we will be concentrating on that, and the treatment will be different for that. If a lady is in the reproductive age group and wants a baby, so then the treatment will be concentrated upon to combat infertility. In that also, as I told previously, the first step will be lifestyle modification. What we need to know is that if a person loses about 5% of their body weight, also spontaneous ovulation starts to occur. So they need to understand that without any medication also, if they are doing a proper lifestyle modification, changes will do happen. Then after that, we have different drugs and methods to improve the to combat infertility, PCOS related infertility. In that, we have ovulation inducing agents like clomiphene citrate, letrozole, which are usually given on the second day to seventh day of the menstrual cycle, and then the doctor will be telling you to undergo some ultrasonography, serial ultrasound, which is called as the follicular study, in which they will be seeing if an egg is forming or not, and if it is increasing in size day by day properly or not, as well as how is the uterus receptivity, whether the lining is proper, the thickness of the lining is, so many things will be seen in serial ultrasound scans, that is called as the follicular study, when a person is being treated for infertility. And once the egg reaches a proper size, then injection is given to cause ovulation, and then the patient is instructed for timed intercourse. So these are some of the methods which are employed by doctors to combat infertility. One is this ovulation inducing agents with follicular study. Then there is another method which is called as IUI, in which there is intrauterine insemination. That is via a catheter. The prepared semen preparation is at the time of the ovulation is inserted inside the uterus. That is one method. And then if all fails, there is another method which is called as the IVF or in vitro fertilization, or in simpler terms, test tube baby. So that is also one of the method which is done. And then there are other supportive medications also which can be given, like mannocitol, metformin, etc. There are so many other things which can be done. But again, I would insist that most important thing to be done is a lifestyle modification, and to try to remain stress free through all of these treatments.
Thank you, doctor, for giving the answers very simply for the viewers to understand that it is very crucial to look after their health and maintain the lifestyle modification, as you said. Doctor, thank you once again for giving us a lot of information. Doctor, it's time that we take some questions from our viewers as well. We have received some questions and some we have received internal questions. The first question Mr. Akshay is asking, what is the main cause of PCOS?
Okay, so PCOS, as I have told, it is a lifestyle disease. So there are two factors which needs to combine for a person to develop PCOS. One is the genetic factor, about which one cannot do anything. Genetic factor is that if you're in your family, for example, if your sister is having PCOS, your mother is having PCOS, or if there is some kind of an genetic susceptibility, then and along with that, if there is any environmental impact, what we understand with the environmental impact, there is irregular dietary habits, there is obesity, there is a rapid weight gain in the recent past. Along with that, there is improper sleep. Again, sleep is also very important. So if there is improper, so all these environmental factors when combined with the genetic factors they contribute to the pathophysiology of the PCOS, and then the patient like this they develop the PCOS. Insulin resistance is also seen in the pathophysiology of PCOS.
Thank you so much, doctor, for answering the audience question. Doctor, there's another question. She's asking, does stress worsen infertility issue related to PCOS?
Can you repeat the question?
Doctor, the person is asking, does stress worsen infertility issue related to PCOS?
Definitely, definitely. Stress is one of the major factors which plays a role in PCOS related infertility. Actually, it is again a vicious circle. Any person who is suffering from infertility, and then there will be a lot of pressure, usually from the community, and then they will be already stressed out. As I told, sleep is a very important, a good sleep is a very important factor to combat PCOS. So obviously there will be disturbed sleep, there will be stress. Stress also causes hormonal dysregulation. So sometimes we even have to give medications to let a patient have proper sleep or be stress free. So stress is definitely related to PCOS. In fact, if we go out of scientific context, we have seen many patients who have taken treatment for the PCOS related infertility. After some time, they leave it and then they become stress free because they are not expecting anything, and then they conceive because the main factor is the stress is not there now. They are like they're not having any expectations, so they are relaxed. So then they conceive because so stress is a very important factor, and one of the thing which can help with the stress is to have a supportive family first of all, and another thing is to you can use yoga, meditation. That kind of thing will definitely help.
Thank you, doctor. So there's another question asking, at what age does female fertility typically start to decline?
Typically, see, the menopause happens in any age between 45, 40. After 40, anytime menopause can happen. But fertility typically begins to decline after 35.
Okay.
After 35, the quality of the oocyte it starts to degrade.
Thank you, doctor. There's one more question. So, what are the risks associated with delaying pregnancy to later ages?
Uh, Pregnancy in elderly women is very common nowadays. So there are many issues which we have to deal with if anyone is becoming pregnant at a later age. One is that first of all, becoming pregnant becomes difficult. Infertility is a major issue as the age increases because whatever you say, there is a biological clock,
Yes.
and then there is something called as ovarian reserve which starts to decline, the quality of the ovum which starts to decline, and there are other health problems which also start along with the age. One is the patient might develop hypertension, there might be diabetes. If there is obesity, then there will be obesity related risks also. So, and then the chances of a patient developing pregnancy induced hypertension, gestational diabetes mellitus, and then intrauterine growth restricted, that is low birth weight baby, all these problems they increase with the age of the patient.
Thank you, doctor. Doctor, there's another question asking, how does the how does the age affect the success rate of fertility treatments such as IVF? You've already mentioned few of the points before.
Yes, age as the age increases, the success it decreases. But anyways, you are talking about IVF.
Yes.
IVF is the last resort, which is that is the last step which is taken for infertility. So usually the patients who are undergoing IVF are of an increased age only. So obviously, if the ovarian reserve is low, if the quality of the oocytes is low, um, the chances of forming a good oocyte, a good quality oocyte, and the number of embryos which will be formed, number of oocytes which will be retrieved, that becomes low. So that causes the decreased success rate with an increase in an age.
Thank you, doctor. Thank you. Thank you so much for answering all the audience questions. Doctor, before we conclude the session, I want to ask you is that what advice or recommendation do you have for women who are considering delaying pregnancy due to personal or professional reasons, but are concerned about their future fertility?
See, nowadays this question is a very common question which we get in our day-to-day practice also. So the thing is that if you have to delay, if there is no other option, then better to get a consultation with your gynecologist so that they can assess your different hormonal criterias, your well-being, and whether you can afford to do that or not. So it will be a better answered on a case to case basis. For example, if a lean thin lady is asking me with all the normal hormonal profile that she wants to delay it till maybe 34, 35 because of some personal or professional reasons, so then it will not have much of an effect in that case. But then if somebody who is already having irregular menstruation, who is having all of the PCO morphology or any other problem, and then if they ask to delay it, it might become even more difficult for them later on. So this is a question which is answered on a case to case basis rather than a general one.
Thank you so much, Doctor, for answering all the audience question and also giving us a lot of information on today's session. Well, thank you so much, Doctor, for sparing your time on 25th of July on World IVF Day. And we wholeheartedly thank you, Doctor, on behalf of my team as well as Human Biological Institute for sparing your time with us. Thank you.
Thank you.
And I know a lot of people who are watching this are benefited from this wonderful session. I wholeheartedly thank our viewers as well for being with us in each and every session. Well, to get more updates on health and live talk with expert doctors across nation, you can all follow us on Instagram, Facebook, LinkedIn, and Twitter. With that, I wish everyone a very good afternoon. A very good afternoon,